So when you think of zeitgebers, timekeepers for human physiology, the first one that comes to mind and the strongest, the most powerful, we think, is light. Everything on this earth evolved to be aware of the pattern of the turning of the earth and the sun going up and the sun going down, sunlight during the day, darkness at night. This is really inherent to the development of life on the earth. And in some ways, it may be why there is life on earth and we're not finding a lot of life on other planets. Because if you look at like how long a day is on Mars, I think it's like 365 Earth days or something like that. Like it's like a lot longer. So it may be that this kind of change in states in the 24-hour is almost ideal for fostering life. So it's a really important cue that has been with us from our development. And we are increasingly being removed from that. And so really there is this big push in circadian medicine, circadian research to just show just how important light is to our physiology as humans and, all animals and plants and, everything on this earth. And one piece of evidence that speaks to the importance of it that I like to think about are these cells in the back of our eye, the intrinsically photosensitive retinal ganglion cells, which are non-visual retinal cells. We have our rods, we have our cones, those are involved in vision, but then we have these third cells that are not involved in the visual pathway at all. The only job for these cells is to detect the intensity of sunlight and send that directly to the master clock deep within our brain, the suprachiasmatic nucleus. And humans are very visual organisms. So if this light pathway was not really important, it would have atrophied. We would not have that anymore. It would sort of have gone by the wayside as we develop more vision and, we're less dependent on it. So it's a really important pathway. And it's supposed to, what it always got for, the evolution of human history was sunlight during the day, no sunlight at night. And now we are really messing with that. So we're getting light. Our indoor lighting is nowhere near as bright as sunlight. Like the days that we were that I was at the conference, it was raining outside and foggy and dark, right? And then inside in the conference, you'd think like, oh, well, it's a good day to be indoors, right? Like it's not that bright outside anyhow. It's a great day. But actually, I took out my little light meter in Boston and it was so much brighter outside. Outside, you have to get the angle just right. But it was something like, 7,000, 10,000 lux outside, which is pretty bright. In the room, I measured when I was watching a talk later in the day, it was actually only 10 lux of brightness, which is like way more dim. And so being indoors, even if you might feel like it's bright, it may not be bright enough to adequately stimulate that circadian system, which is going to weaken our metabolism and weaken our sleep wakefulness drives. And so a group of circadian rhythm researchers, the world's best experts in circadian research, got together a couple of years ago and came up with this consensus document, which was published in 2022, which is recommendations for daytime, evening, and nighttime indoor light exposure to best support physiology, sleep, and wakefulness in healthy adults. And I love that they put it in that order, right? Physiology is first. Like it's not just about sleep wakefulness; it's really about our whole health. And so you can read this document if you want. It was published in PLOS Biology in 2022, like I said, and they just give these recommendations. And what's cool is with these newer recommendations for lighting, the recommendations all used to have to do with the rod and cone exposure to lighting and trying to make things avoid eye strain, basically, to make things appropriate for eye dynamics, I guess, for visual dynamics. But now these newer recommendations are actually based on the circadian system. So instead of saying, just regular lux, which is a rod cone value, they say it's this melanopic equivalent daytime illuminance lux, which is how much it stimulates those intrinsically photosensitive retinal ganglion cells. And so it's really cool. And it's similar, the brightness, like my lux meter, what I said with the 10,000 lux and the 10 lux, that's just regular lux. So that's for the rods and cones. If you put it for the circadian cells, it would have been still probably about 10,000 lux when I'm outdoors, because that's the right type of stimulation. But indoors, that 10 lux would go down to like 2 lux because it was a warmer colored lighting. It turns out that it is the cool part of the color spectrum, the green and blue tones that maximally stimulate the circadian system, which makes sense because as the sun moves in the sky, the intensity of the blue-green colors kind of changes the most between early morning light, midday, and and sunset. And so, that's kind of what humans and all animals evolved to be sensitive to, although we also do have pathways for the other colors of light. So it turns out every color is important, but those are the most important from the circadian standpoint. So you can look at those recommendations. And I would say for patients with neurologic disorders, definitely they should be following those recommendations. If you have a patient who is homebound, can't go out with advanced dementia or some other debilitating neurologic condition, at a minimum, you can say, hey, let's look at your indoor lighting, right? Let's try to improve this. Let's open up the window shades. That's what I love about doing Zoom visits is I'll do this with patients all the time. So I see a patient with dementia in my clinic and they're in a dark room with the window shades closed. And I say, hey, what's that window behind you? Can we go ahead and open that up? And sometimes they have a really good reason, like our neighbor stares in, or, there's it gets too hot, or there's some reason, but I want them to justify to me why that window shade is closed, right? And if there is no reason, that window shade should be open. And my husband always jokes with me that I use the lights when you're not supposed to use the lights, and I don't use the lights when other people do use the lights. And what he means by that is I strive to make my indoor environment as bright as possible. So somebody might walk into a room with the lights off and the window shades open and be like, oh, this is plenty bright. But for me, is it as bright as outdoors? No, it's nowhere close to as bright as outdoors. So I'm going to go and turn on those lights, right? Luckily, they're LEDs. They don't use that much electricity. And it's going to be kind of the full spectrum that includes some bluer tones. And then in the evening, right, when the sun's down, oh, it's so dark in here, turn on the lights. No, let's keep it dark. Let's have that mood lighting for 2 to 3 hours, 1 to 3 hours before bed, depending on the person. And so you actually don't need it to be totally dark in the evening. You can just use the right type of lighting. You can avoid that melanopic stimulating light, the cooler colors, and you can just use warmer color lights in the evening and still be able to see plenty well, not be stumbling around, and then also, be kind to your circadian system. And then there's recommendations about during the night too. You want it kind of to be as dark as possible when you're actually sleeping.